Good afternoon, everyone. This is Dr. Jeff Gelblum, your neurologist from First Choice Neurology from sunny South Florida, coming to you live from the Aventura Medical Tower here in downtown Aventura, which is basically a nice suburb of North Miami. And purpose of today's discussion is to share with you some very important and new information regarding how to address your risk for Alzheimer's disease. So why is this important? Well, first of all, we know that Alzheimer's disease is a devastating condition. All of us on today's conference call know someone who has Alzheimer's disease or has had Alzheimer's, either a member of our family, a friend, a neighbor. So we all interact with Alzheimer's disease on a daily basis. Now, here in my office, we interact with Alzheimer's disease on an hourly basis because my practice has a strong focus in dementia. And of course, Alzheimer's disease is one of the commonest causes of dementia. One of the first questions I always get as a neurologist is, gee, doc, what's the difference between Alzheimer's and dementia? Well, that's like saying, what's the difference between breast cancer and cancer? Cancer is the overriding designation or condition, and then we've got different types of cancer: breast cancer, lung cancer, prostate cancer, etc. Same thing with dementia. Dementia is the catch-all phrase describing someone who has problems with short-term memory and a component of functioning like language or getting lost or visuospatial. So that's what dementia means. And then we try and classify the dementia into its subtypes. We know that Alzheimer's is the most common form of dementia. Individuals with Parkinson's disease can often have dementia. Obviously, if you've been shot in the head, you'll have dementia. Individuals with a stroke can get vascular dementia. So we're aware of the many different forms of dementia. Alzheimer's disease tends to be the commonest form of dementia. That's something that my practice has a very strong dedication to, and we're really aiming to try and eradicate this condition, as well as all neurology. So all of my neurology colleagues are very in tune to this disorder. We've come a long way in the past few years, and by coming a long way, what I mean is we've not only got great tools for the diagnosis of dementia, but we've now got medications that are FDA approved for the treatment of dementia, Alzheimer's dementia particularly. So let's talk about how to diagnose Alzheimer's dementia. Well, we can use PET scans, which are X-ray studies of the brain, to look at the amyloid plaque, which is that gunk that attacks brain cells in the Alzheimer's state. We can use spinal fluid evaluation, meaning you can have a lumbar puncture where we stick a little needle in the base of your spine to send that fluid that bathes the nervous system off to the lab, and we get back a result that tells us about the amount of amyloid plaque in the central nervous system. So we've got PET scan tools, we've got lumbar puncture spinal information that we can get. We've got MRI scans that look to see if the dementia could be caused by something structural, such as a stroke or a tumor. So we neurologists at this point in time, in March of 2023, have a really good idea of how to specifically diagnose Alzheimer's dementia. So anybody who goes to the doctor and says, well, I don't know if it's Alzheimer's or another form of dementia, or maybe they're just getting old, that doctor is not doing their job. Because in order to do your job as a neurologist, or certainly as someone who deals with older folks, you should be able to diagnose dementia, Alzheimer's dementia, definitively. It's not a diagnosis of exclusion. It's not a wastebasket diagnosis where I've ruled out all these other things, so it must be Alzheimer's disease. No, that's not how it works. So if you're having problems, or your family member, neighbor, loved one is having difficulty with short-term memory, and having some difficulty with other activities of daily living, driving, homemaking, keeping a clean house, meal preparation, getting dressed, bathing, etc., then that suggests a dementia disorder. And then it's up to me as your neurologist to make a diagnosis of Alzheimer's disease. And we can do that easily, and we can do that each and every time that patient presents to the office. And then, of course, once we make that diagnosis, we have treatments that we can provide. We've now got 2 drugs that are FDA approved to modify the amyloid plaque burden in the brain of an Alzheimer victim. Those drugs actually take the amyloid plaque off the brain. And then we've got other drugs that can certainly impact the symptoms of Alzheimer's, drugs that can impact on acetylcholine, which is the chemical that's deficient in an Alzheimer patient. That chemical is required for short-term memory formation. And then we've got other drugs that act on the glutamate brain pathway. So we've got many medications that we can use to help the cognitive symptoms. And then we've got medications that we can use to help actually modify the Alzheimer plaque. So with that being said, we've got great treatment available, great diagnostic tools available. So here in March of 2023, we've got access to all the things we need to diagnose you and to treat you. And so these are very remarkable times, much different than where we were just a few years ago. So let's talk about the risks. How do we define the risks of Alzheimer's disease? Because all of us on today's teleconference are concerned about your risk of Alzheimer's disease. If you have a family member with Alzheimer's, I think it's very important to know your risk. If you don't have a family member with Alzheimer's, I also think it's very important to know your risk. Now, there are tests out there that anybody can buy, something like 23andMe. And those tests do what I would say is a not so great job of truly evaluating your Alzheimer risk. And let me tell you why. When you sign up for a 23andMe test, when you get that test in the mail by just going on 23andMe, really the only thing that that test is looking at is what's called your genetic APOE score, meaning your genetic APOE. And it's only looking at APOE4 or APOE3. So let me take you through what the APOE genes are, because a lot of people want to know, what does APOE mean? Well, APOE is a determinant of amyloid plaque in the brain. But the problem with APOE3 and APOE4 is that they don't tell the whole story. In fact, it's been said that people who are APOE4 carriers or double APOE4, you know, you have 2 genes of every gene product. You have 2 copies. So APOE4 has always been historically thought of as a bad risk of Alzheimer's disease. So if you call up 23andMe and you get that test and and you take the test and you get back the report that says APOE4, that is not a happy finding, because that could suggest the risk of early onset Alzheimer's disease. However, most of us on today's conference are not really so much concerned about early onset Alzheimer's. We're concerned about late onset Alzheimer's disease. And for late onset Alzheimer's disease, it's not just about APOE4. It's not just about APOE3, and it's not just about APOE2. In fact, it's not just about the APOE genes, because we know that in about 40% of the population, Alzheimer patients, meaning 40% of Alzheimer patients, don't have an APOE4 gene, or 30 to 40%. So what that tells me is that APOE4, if I get back an APOE4 result, that's not going to tell me the whole picture about your future risk of Alzheimer's disease, because we know that Alzheimer's disease is much more than just the APOE4, APOE3, APOE2 gene products. In fact, we used to say that people who are APOE3, meaning 2 copies of APOE3, were at literally no risk of Alzheimer's disease. Yet we know that individuals who have APOE3 can come into my office with late onset Alzheimer's disease. So I'm throwing a lot of information at you right now, and I know at times it can be confusing. I want you to understand that the genes that you commonly hear about, particularly with 23andMe, talk about APOE3, APOE4. Historically, we always thought that double APOE4 was really bad and double APOE3 was really good. Yet we know that individuals with double APOE3, which was historically thought to be really good, can actually develop late onset Alzheimer's disease. A small percentage can. So the story, the genetic story of Alzheimer's disease is really much greater, much larger, much more expansive than just the APOE story. So that's why we neurologists, we may screen for APOE4, but it doesn't tell the whole story. You can get an APOE4 test if you go to Quest or LabCorp. You can get an APOE test if you subscribe to 23andMe, but it does not tell the whole story. Because as I've just said, folks that have double APOE4 genes, which we always thought was always bad, yes, they can develop early onset Alzheimer's disease. But individuals with double APOE3, which we always thought was super good, can still develop late onset Alzheimer's disease. So you're saying to yourself, well, gee, what is the most sensitive diagnostic tool that I can use to assess my risk of Alzheimer's, late onset Alzheimer's disease? At this point in time, probably the most accurate and sensitive tool that you can use is something called the Genoscore. The Genoscore is a test that not only looks at APOE, but it looks at about 100,000 other genes in your body that are correlated with late onset Alzheimer's disease. So the Genoscore is a far more expansive look at your risk of late onset Alzheimer's disease. Genoscore, that's the name you have to know. And what the Genoscore does is it looks at over 100,000 genes in addition to APOE that have been correlated with Alzheimer's disease. So are we doing the Genoscore test in my office? Yes, indeed. We do that each and every day. How do you do the test? Well, the Genoscore is a saliva test. It's a saliva-based test. So the patient comes into the office or we give them the kit to take home. You basically give a sample of spit, of saliva, into a test tube, and that is sent FedEx to the lab in New Jersey. Approximately 4 weeks, or maybe 6 weeks sometimes, 4 to 6 weeks later, we get back a report. And the report looks something like this. So basically what the report does is it not only shares with us the APOE3 status, but it also gives you what's called a Genoscore risk. So what is the difference between the APOE3 status and the Genoscore risk? Well, here you can see, and this is, of course, an anonymous patient of ours. We're not going to violate HIPAA, that's for sure. So here you have the APOE3, double APOE3. So if you got this back from 23andMe, you'd say, oh, hallelujah, no risk of late onset Alzheimer's disease, except that we know that there is a risk with late onset Alzheimer's disease, even with APOE3. So the beauty of the Genoscore is here we have APOE3, but then when we go in and look at the 100,000 other genes that have been analyzed via this very complex saliva test, we can see that the risk is actually 0.6. So what does that mean? It means that more likely than not, there are other genes in your body that could contribute to your risk of late onset Alzheimer's disease. So what do those genes involve? Those genes involve everything from metabolism to heart functioning to blood pressure management, all of the other genes that we know that have been correlated with late onset Alzheimer's disease. So although we've got a good reading on the APOE3 side, we've got a actionable reading on the Genoscore side. So the Genoscore, to me, is a much more comprehensive approach when looking at your risk for developing late onset Alzheimer's disease. So what do we do with this number? Because you say to yourself, well, this looks good, and if it were APOE4, definite Alzheimer's, maybe I'd want to treat with one of these disease-modifying drugs. With this alone, we would probably do nothing. However, with the Genoscore on top of this, at this point, I as your neurologist have to say, look, if you're overweight, you got to lose weight. If your diet is bad, you've got to get yourself on the Mediterranean MIND diet. You want to write that down, MIND. It's also on our website at First Choice Neurology. The MIND diet is a diet that is specifically geared. It's got a lot of the Mediterranean influence, but it's specifically geared and has been shown to be very helpful in mitigating your risk of late-onset Alzheimer's disease. So therefore, when I see this kind of data, I say, well, the good news is the APOE gene data looks good, but the slight elevation at the 0.6, because the continuum goes from 0 to 1. So 0.5 and less, nothing to worry about. 0.6 and greater, you have to start to do some lifestyle and diet interventions. So when I see this type of report, which I get back very commonly in my office, I sit down with that patient and I say, well, look, if we'd only done 23andMe, we wouldn't know the whole story. But now that we've got the Genoscore report in front of us, we know the story. And the story is that, yes, there is a slightly increased risk of developing Alzheimer's disease later on in life. And the way we manage that risk is with lifestyle and diet. And the diet that I would have to recommend immediately is the MIND diet. It's a Mediterranean diet. You can look it up, MIND. And it's really low on the butter, low on the cheese, low on the simple carbohydrates, low on the sugar, but very high with fish, particularly oily fish like salmon. High in berries, high in nuts, high in vegetables, high in fresh fruit. So you know what's good for you, and the MIND diet really reinforces that. And this is the type of counseling that I give to my patients each and every day, because I sit with this report and I say, look, we've just gone to the trouble of getting this Genoscore test. Now that we've got this useful information, what are we going to do to mitigate your risk of late onset Alzheimer's disease? And the MIND diet is the first place to start. The second place that we need to start is with daily exercise, because we know that just 30 minutes a day of vigorous walking has been shown to limit your risk of late onset dementia. So with all of this, we've got amazing tools at our fingertips that can allow us to really determine what your specific risk is for late onset dementia. And we can intervene and we can do things about it. So that's why our practice here at First Choice Neurology is committed to really understanding what your genetic risk will be for late onset dementia, because at this point in time, in March of 2023, we can intervene. So I'm passionate about reaching out to my patients and making sure that we fully understand what your specific dementia risk is. The good news is this test is non-invasive. It's something that we're using each and every day in our office. It requires simply a saliva sample, so patients can take it home and do it in the privacy and comfort of their own homes, send it off via FedEx, and voila, I get the report back in approximately 4 to 6 weeks. One of the commonest questions I get is, well, why can't I just get the report back as a patient? Why does it have to go back to Dr. Gelblum? I think it's very important that when we have this Genoscore information, that the doctor is there to not only explain to you what an E3 means, which is ostensibly good news, but then explain what the up top Genoscore means, saying, look, there's a concern, and we're going to intervene by doing all of the right things we need to do. If there's an E4, then of course we have to intervene pharmacologically and treatment-wise, because E4 on this test, if this were E4, then that would signal, that's a very strong signal for early onset Alzheimer's dementia. So we've got a lot of information that we can share and discuss with our patients. The report comes back, it's several pages. It talks about what your evolving risk will be as time goes on. So the Genoscore information is imperative for me to give you the entire full picture about what your future risks are for late onset Alzheimer dementia. We are doing this test each and every day in our practice. So if you want to learn more about this test as it pertains to you as a patient, please log on to First Choice Neurology website, fcneurology.net, and at that point you can learn more about this test. Or if you want to simply schedule a neuro chat to talk to me or one of my colleagues about the importance and the benefits of this Genoscore test, then just log on to neurotogo.com. That's NEURO2go.com, Neuro2go. It's at the bottom of your screen. So neurotogo.com is a great resource for you to come in and chat with me or one of my neurology colleagues about this test and how it has application for you or your whole family. If grandma had Alzheimer's and you're in your 40s and you've got a child and you want to know what the whole longitudinal family risk is, we can do this Genoscore on anyone, regardless of the age. If you have questions or are concerned about dementia in yourself or in a loved one, then probably you would want a telehealth virtual visit or a real live visit with myself or one of my colleagues at First Choice Neurology. I've shared a lot of information with you over a very, very short period of time. What I want to recap is that these are really good times. They're not the best of times, but they are certainly good times and certainly better times with regard to the screening, the evaluation, and the treatment of Alzheimer's disease. So we're in a place now that we haven't been before, and that's a good place to be. We can certainly test your specific risk for the development of late onset Alzheimer's disease, late onset dementia, with something as simple as a saliva sample and then sending it off via the Genoscore platform. And with that, we'll get back very useful information that not only tells you about your APOE status, which is the only thing you're going to get from 23andMe, but tells you about the 100,000 other genes that can contribute to the development of late onset Alzheimer's disease, and that's the power of the Genoscore. So I invite you to please share this important information with your friends, your loved ones, neighbors, etc. Let them log on to Neuro2go to learn more about how this Genoscore can help you and the doctor assess your risk and what steps can be taken to mitigate that risk going forward. So please log on to Neuro2go.com. Learn more about the Genoscore test. You can Google it, Alzheimer risk test, and you will see how this test is available in your community. And of course, we can always get the test available to you by just logging on to Neuro2go.com, and we'll send it out to you, whether you're in Oklahoma or Ocala, Florida. We're here to help you and certainly serve as a resource for you to understand how to manage your concerns and your risks of dementia. So I am very grateful for the opportunity of being with you today. A lot of information has been shared. This information will be repeated later and will show up on our website, fcneurology.net. So please feel free to log on. And if you have any further concerns or questions, hit me up with Neuro2go.com, where we can schedule a chat and I can share and recap the information. Or if you want a regular visit, feel free to visit me in my office in Aventura, Florida, or virtually on fcneurology.net. I appreciate your attention today. Information is always good and always helpful and always empowering. And my job as your doctor and as your neurologist is to educate always and try and treat most of the time. So I appreciate your attention today. Have a great afternoon. And we'll be circling back in the near future to give you more exciting updates and information about all the good progress that's going on in the dementia treatment space. Thanks again. Have a great afternoon. Bye-bye.